Hello, PsychU community, and welcome to today's webinar titled Impact of Novel Coronavirus Pandemic on Mental Health. My name is Dr. Stephen Murray from the PsychU team, and I'm going to moderate our discussion today between Dr. Christine Moutier and Mr. Paul Gionfriddo. So we're going to give a little bit of an introduction to our speakers who are on our panel today. Paul Gionfriddo is the president and CEO of Mental Health America and the PsychU Stigma section editor. Dr. Moutier is our chief medical officer at the American Foundation for Suicide Prevention, and is also a board-certified psychiatrist. I want to thank you both today for coming in on kind of a unimaginable time that we're in right now, and discussing such an important topic with our PsychU community. Just a reminder, this program is paid for by Otsuka Pharmaceutical, Development and Commercialization, and Lundbeck. Our speakers are paid consultants of Otsuka and Pharmaceutical Development and Commercialization. So we're going to get into some of our rules of engagement with our webinars. If you've not been on them before, just some top line information that you'd be aware of. Otsuka and Lundbeck have entered into collaboration with a partner called Open Minds to explore new ways of bringing and increasing awareness around serious mental illness. Otsuka Lundbeck's interactions with Open Minds through PsychU is a non-branded online portal dedicated to providing information and resources important to disease states and care delivery topics related to mental illnesses. One of our methods for sharing this information is the hosting of these types of webinars. And these webinars are based on the following parameters. We have several things we focus on with our webinars. So when we conduct any kind of medical dialogue, whether by presentation or debate, Otsuka Lundbeck and our paid consultants aim to provide the viewers, our PsychU community, with information that is accurate, not misleading, scientifically rigorous, and does not promote any of the Otsuka or Lundbeck products. There is no continuing medical education that is offered through our PsychU programs. Otsuka Lundbeck and our paid consultants do not expect to be able to answer every single question during our PsychU webinars. However, we'll do our best to address important topics and themes that do arise throughout the conversation. Otsuka and Lundbeck's our discussions, are basically there to help, not guide or offer any kind of suggested legal or suggested advice to answering specific patient questions. And our employees or contractors should not participate in the program unless they've received or expressed approval to do so by our legal affairs, which we have done. So let's get started with our actual program today. And again, thank you, Paul and Christine, for joining us today. And we'll kind of get it started with just really asking, through your various organizations, American Foundation for Suicide Prevention and Mental Health America, what are some of the things you're doing to kind of address this pandemic? Christine?
Yeah, sure. We're really looking at this as a global sort of impact and stressor in so many different ways, but it's a rare person these days around the globe, let alone in the US, who isn't being affected in some way. And so thinking about how we can protect our mental health in the most proactive ways possible, and not just for ourselves as individuals, but really families and communities kind of coming together really around the issue of social distancing, emphasizing the ways that we can stay connected and protect ourselves that way. What we have been noticing is through our work on social media and various media engagement and through our chapter network as well, that there is a dialogue right now with this pandemic that I'm not sure has ever been there before, that is paying attention to the mental health and well-being of all of us while we're taking care of ourselves physically and protecting and really trying to flatten the curve of viral contagion.
Paul, your thoughts?
Yeah. Let me jump into, and I agree with all of what Christine has said. And the fact is that we're having opportunities to talk about mental health and the importance of protecting our mental health that we haven't had before in similar kinds of circumstances. At Mental Health America, we've put together an extensive COVID-19 microsite and web page that include a lot of resources, not just our own, but resources from other organizations as well. There's a lot of good information out there, and I really encourage people to find it through organizations like AFSP, Mental Health America, and others. In addition to that, we've been working a lot on our social media outreach. We've been doing a lot of events. We've been doing a lot of information sharing through social media because it's a way we reach a lot of younger people. We've also been monitoring the increase in anxiety screenings that have been occurring since people have become more worried about the spread of coronavirus, and have been learning some important things from that I'm sure we'll have an opportunity to talk about later. And we've also been engaging around public policy. There have been a lot of activity, a lot of initiatives at the federal and state levels to try to bring emergency relief and support to people who are impacted by coronavirus. And we've been trying to make certain that at the same time, they bring relief and support to those who are being impacted on the mental health side, and also to the broader community of nonprofit organizations that provide so much of the service to people in need.
Great. And I know, one of the big topics we keep talking about is social distancing. And as you PsyQ community can see, we're practicing that by, not being in the same room together, which we normally would do for these types of, video webinars. We usually get together and kind of go through this in the same room. So we're at our own homes doing this today and bringing this to you. But can you comment on social distancing and isolation? How is social distancing good for overall mental health? But more importantly, how can it be bad? Paul, why don't you jump on this one to start?
Sure, I'm happy to jump in, and I know Christine will have a lot more probably to say about this too. It can be difficult and challenging when we're engaging in social distancing because, I often say for people with mental health conditions, they're by nature isolating, and so if we isolate further, it makes it even more difficult to connect. And for people who don't have them, same thing. We start to get very anxious, we get very nervous, and we see it. And for some people, the worry and legitimate worry that we're all facing will transform to anxiety. And when people are distanced, they may not be as likely to ask for help or to seek help or to seek resources or supports. It's why we have to move people into more virtual neighborhoods if we can. And I'm proud that Mental Health America has been experimenting with these virtual neighborhoods for the better part of the last decade. And I think that there's a way to use these virtual neighborhoods to support people, even when we can't all be together in the same room. This alone, being able to see one another as we talk to one another here, is extremely important. And in fact, a bit uplifting to me sitting in my home in a state where it's been recommended that we not get outside of our homes too much.
Yeah, thanks, Paul. Excellent points. When I think about the term social distancing, it's even kind of like, did we need to call it social distancing? Because it's really about physical proximity to protect and contain the viral spread. And so I've actually been calling it physical distancing and really an enhancement of social connection. Everything Paul said is so true for people. We all have mental health to take care of, whether we have a mental health condition or not, just like we have physical health that exists along a continuum, and there are things that we can do very proactively. We are also social creatures by nature, and so it is simply not healthy or good for us to have isolation. And like Paul mentioned, if you do tend to have struggles with your mental health, that already pulls you, it's a force towards isolation. So we all really need to actually go out of our ways and find ways to connect with each other. And of course, there are so many ways that maybe we can talk about later to do that. I do think that there's both, the downside, of course, is that there is the loneliness epidemic has been discussed without this social distancing stuff going on. And whether that is something that's crept into our culture, whether it's an impact of, generational expectations, the influence of technology, all of that, I think in our highly civilized, evolved ways, I say that sort of facetiously because in many ways we've gotten away from some of the very basics that keep us grounded and healthy as human beings, and that is by connecting. So I think we need to actively fight that pull towards isolation. Check in on yourself, reflect if you're one who tends towards those negative feelings of loneliness and isolation. know that there are things that you can do. And I'm actually hoping that through the efforts that are going on at Mental Health America, at AFSP, PsychU, so many places, and definitely on social media, there are some beautiful trends towards connecting and uplifting one another. And I'm hopeful about that, because that is significant, actually. We feel it even just being on this video chat together, and these kinds of things have an impact on us. And of course, we worry about the people who are not able to tap into that and really think about outreaching to those individuals in particular.
Yeah, so on that note, what are some of the tips or some of the things we can do during this time of social distancing to kind of help with our overall health, including our mental health? Christine, why don't you were kind of pinpointing that earlier a little in your discussion. What are some of the things you can think of?
Yeah, there's so many things. If you think about the way that you already know how to take care of your mental health, and I guess if you haven't been someone who's paying a lot of attention to that, now most of your audience here are healthcare providers and hopefully have been thinking about that, but also in your work with patients. There are many things that we have more control over, or a little more influence and power in our lives than perhaps we realize. And one of the first things that I use for myself and my loved ones, and I used to teach medical students all the time, is be a student of yourself. How do you tick? In addition to the very basics that every human being needs to keep their physical and mental health well, like sleep, exercise, good nutrition, some structure and routine in our lives, and social connection. But in addition to that, we all have some kind of interesting and sometimes unique ways that we feel the most grounded and the most centered. And so now is a time to actually practice those in spades. I'm a big fan of using a calendar and scheduling those activities as sort of non-negotiables, even during a time of stress. That tends to be a time when those things that we grew up not viewing them as essentials, so they seem like luxuries or non-essentials, and they tend to go out the window. We might, we let ourselves fall into patterns when we're under stress, and that's actually the time that we need to take an extra effort. I have a model in my mind that's a sort of a reservoir, a tank, where the stuff that helps us to maintain mental health and resilience is being constantly drained, and we need to fill that reservoir, not maybe all the way full all the time, that's not entirely possible, but full enough to keep us well and coping at our best. And of course, it's not about perfection, it's about a work in progress and striving towards more of those healthy habits.
Paul?
Yeah, I'd love to add on to that a bit too, because I agree with it all. And some of the things that I've been recommending for people to stay connected is, a lot of our constituency at Mental Health America is younger, and they connect by texting. And I suggest if you typically connect by texting, try a phone call. And if you typically connect as part of an older population by phone, try using the video phone capabilities on your smartphone and connect a little more that way. I often suggest also to just try to stick with the kinds of morning routines, for example, that you would normally have. No reason not to get up and do pretty much the same thing you did the first hour of every day. That's what I do. And instead of walking a block to work, I just walk into the other room. We have two different staircases in our house, and my wife's been teasing me because one of them is my work staircase and the other is my home staircase. So throughout the day, if I'm going to get out to the kitchen I use my work staircase, and at the end of the day, I use my home staircase to do it. It's important, I think, too, to do those things that you enjoy doing. And Christine, like she said, you don't have to add all the way up to 100%, fill this stuff up. But for me, I'm sitting in a room right now with my accordion, and I've played my accordion for 60 years. And I'm having an opportunity to play my accordion a little more often than I've been playing my accordion over the course of the last few years, because it's here with me in Connecticut and not 300 miles away when I'm working in Alexandria. I'm not suggesting that everybody go out and buy an accordion at this point and start playing it, but it's what I do to help me feel better. And all of us have those things that we can do and have done throughout the course of our lives that have made us feel better, that we maybe have a little bit of time to do now and to take some time to enjoy doing them and spend a few extra minutes with them. And that can be helpful.